Hello everyone. Today we are going to discuss about the disorders of the digestive system. There are a number of clinical conditions which may occur in the digestive tract. These are as follows. The first problem we are discussing about is acidity. Acidity is a digestive disorder in which the hydrochloric acid or HCl moves out of the stomach and reaches to the esophagus by antiperistalsis movement. It is generally caused due to the intake of heavy meal. It may also occur due to the consumption of some citrus food like pickles, some citrus fruits like lemon, oranges, etc. It results in the burning pain or the burning sensation in the lower chest area, and this can be reduced by the intake of antacids. Next, we move to the next problem, that is peptic ulcer. Peptic ulcer is the breakage of the inner lining of the digestive organs like stomach and small intestine. If the problem occurs in stomach, the condition is called gastric ulcer, and if the problem occurs in small intestine, the condition is called duodenum ulcer respectively. It is generally caused due to the bacterial infection, and the bacteria which is responsible for this condition is Helicobacter pylori. Abdominal pain, loss of appetite, weight loss are some of the symptoms of peptic ulcer, and peptic ulcer can be treated by antibiotic medication. The next problem we are talking about is gastritis. Gastritis is the inflammation of the lining of the stomach. The common symptoms include upper abdominal pain, vomiting, nausea, and some others. It is generally caused due to the bacterial infection of Helicobacter pylori. It may also occur due to the excessive alcohol consumption. Treatment includes medications such as antacids. Thus, antacids can relieve the problem. The next problem we are talking about is indigestion. Indigestion means incomplete digestion of food. It results in the discomfort in the abdomen, and the most common reason of indigestion is overeating. While overeating, the digestive enzymes become incapable to digest the food, and thus the problem occurs. Thus, by avoiding spicy food and too much eating can reduce the chances of indigestion. The next problem we are talking about is diarrhea. Diarrhea is the condition of having at least 3 times liquid or watery bowel movements each day. It is generally caused due to viral or bacterial infection. It may also cause due to open defecation. There are several types of antidiarrheal medications, but this should be taken as per the advice of the doctor or physician. The next problem we are talking about is constipation. Constipation means infrequent and hard bowel movement. In this case, the stool is often dry and hard. Generally, it is caused due to the low fiber diet and dehydration. Thus, intake of plenty of water, that is drinking of plenty of water, or the intake of fiber rich food are the best remedies for constipation. The next and the last problem we are talking about is piles. When the vascular structures in the anal canal get swollen and inflamed, they are called piles. Discomfort during the bowel movements is the common symptom of piles. Irregular bowel habits, lack of exercise, low fiber diets are some of the common causes of piles. Thus, a high fiber diet along with stool softeners can be effective in the treatment of piles. So this is all about the disorders of the digestive system. Please like and share our video. To receive more interesting videos and notifications regarding our online videos, just press the bell icon and subscribe our channel eShekha. Thank you so much for watching the video.